And I wanted to say from the very beginning that I really like this new device, and this would have not been possible without this probe.
I think the beauty of this device is the fact that you can couple with some treatment and changes in treatment.
That's very simple, and we have the information much faster.
And we were able, yes, to keep the patient dry, but at the same time to do fluid challenges and assess this.
I was very impressed actually with the way the probe went down the nose and straight down the esophagus.
You can rapidly see the changes in volume over time.
It is much easier than transthoracic echo.
I'm pretty convinced that using those 3 views, because when you handle the probe, it's pretty easy to do.
Which is physiology in action.
You cannot argue when done continuously will be better than only done once in a while.
This is essential to evaluate hemodynamics.
We couldn't have done this without our customers' leadership in clinical studies and peer-reviewed papers to provide the evidence of this technology. And most importantly, to see the impact and optimization for cardiac performance over time.
Look at these 3 views to understand the basics or the determinants of cardiac performance, identify what the problem is, individualize the patient's therapy, leave the probe in place, change your therapy, and then iterate that over time.
We believe that the hTEE is a breakthrough in technology. And not just in technology, but really in workflow. How do we integrate it into your practices, and how do we help both you and your clinicians and the nurses, and frankly with administration, to help drive out cost.
The moments just after a person has heart surgery are crucial and can mean the difference between life and death. But now a first-of-its-kind device is helping doctors monitor heart patients like never before. After bypass surgery, doctors used a first-of-its-kind device to monitor Vanessa's cardiac function right at the bedside without wheeling her to another room for an echocardiogram.
This now really allows us really a minute-to-minute evaluation of the patient as we change medical management.
Inserted in the esophagus, the hTEE probe allows doctors to watch in real time the heart's pumping function and volume, helping them decide whether to add or subtract IV medications in an instant.
So with the probe, we were able to differentiate reasons for her low cardiac output syndrome, avoid a return trip to the operating room.
That monitor can be used on patients for up to 72 hours. The doctor says it's changing how he practices medicine because it helps make safer, more informed decisions when it comes to patient care.